Hello, this is Dr. Joanne Sarembis, and I'd like to present a video on the introduction to health policy and politics in nursing. You'll notice that this will follow similar to the first module in your course, in which it really introduces you to the idea of health policy, what is that about, and takes you all the way up to being an activist and an advocate. We'll go more in depth in those areas further along. Now, of course, we have certain social determinants of health, and the World Health Organization in 2016 gave us this great definition of what those health determinants are. And they're basically the conditions in which people are born, where they live, where they work, where they grow, and their age, and a wider set of forces and systems that really shape the conditions of their daily life throughout time. These forces and systems also include economic policies and systems, development agendas, social norms. What are the social policies and political systems in their particular area, but also in the wider scope in which they live. Now here is an excellent figure regarding the social determinants of health. And as we look at that, we can see in the center we have man, individual lifestyle factors that have to do with age, the gender, and constitutional factors that each individual has when they're born. Later, we're going to look to the social and community networks in which the person begins to grow and to live. And again, these can change over time. As we look at that wider scope in the purple and green, the general socioeconomic, cultural, and environmental conditions in which an individual lives, we can begin to see how these can really affect their health. So, for example, what is their housing? Do they have their own home? Do they have a place where they can seek shelter? Healthcare services. Are they in their area? Are they nearby? Can they access them through public transportation? If they have medications, is there a drugstore nearby? Are they able, again, to get to that drugstore or have them delivered? Water and sanitation, which might seem rather basic, but in some areas is really not. Unemployment. And what is their work environment? Is that work environment a safe work environment? And again, we're going to turn our attention to that later in this particular course. Education. What is the educational level of the individual? And also agriculture and food production. So not only the production, but is it available to the individual? And we find that in some areas of large cities, a food market may not even be available to the individual. And so we're going to talk about that. So trying to eat a healthy meal may be something that they have a great problem with because they can't access it. Now there's political aspects of those social determinants of health as well. Health is determined not only by social factors, but those social determinants of health produce great inequities in health as well. If you can think about it as the haves and the have-nots, if you will. So the poor and disadvantaged really experience worse health than the rich. They have less access to care, and they die younger in all societies. Social determinants of health can be measured. They can be described. The measurements of social determinants provides evidence that serves as a basis for our political action. Now, the political aspects of social determinants of health, to speak further about them, evidence for these is generated, and it's used in a continuous cycle of evidence production, policy development, implementation of those policies, and then an evaluation. Do we need to tweak the policy, for instance, rewrite that policy? Evidence of the effects of policies and programs on inequities can also be measured, and they can provide data on the effectiveness of the interventions that we seek to help individuals. Evidence regarding the social determinants of health is insufficient to bring about change on its own, however. So political will combined with evidence offers the most powerful strategy to address the negative effect of the social determinants that we talked about. Now, there's a triple aim for reforming health care, and this was put out by the Institute of Health Information. And the framework describes an approach to optimizing health system performance. It is the IHI's belief that new designs really need to be developed to simultaneously pursue three dimensions. That's what they call their triple aim. Now, I have a picture down in the right-hand corner that talks about this triple aim. First being population health, second being per capita cost, third the experience of care. And so improving the patient experience of care, including quality and satisfaction, is part of that triple aim. Improving the health of populations also, and then reducing the per capita cost of health care so that we can keep it both cost effective so individuals do have access to that health care. Now here is a very interesting site. This is from the Robert Wood Johnson Foundation, and as you can see that within certain modules in the beginning, we've really tried to introduce you to sites that you can go back to throughout the rest of your nursing career. If you follow the link at the top of the page, what you can then do is you can put in your county anywhere in the country, also just the state. And what you can then see is how it's rated. And this has to do with health outcomes. So if you wanted to say, well, geez, how healthy is a particular county in Pennsylvania, just in our area, and this is just in our Philadelphia and surrounding area, there are 67 counties in the state of Pennsylvania. Unfortunately, Philadelphia, the largest city of those, is 67 out of that 67. You can see that Delaware County now is 39 out of 67. Bucks County is 12. Montgomery County stands at 6. And Chester County is 4 out of that 67. So the lower the number, of course, the better the healthy outcomes within that county. There's also a framework for our action, action as nurses, action as healthcare providers. And the framework has 4 spheres of political action in nursing. Each of these spheres have their own independent functions, but they can also overlap. And you can see that in the figure that I have at the bottom of the slide. And they can affect other spheres working together to create change. Now, nurses are capable of influencing policy, which we'll be talking a great deal about within this course. And policy making, and you can do that to improve the problems in the community and also the larger healthcare system. So those 4 spheres, first you have to talk about the workplace, addressing issues affecting jobs and also patient care. Next would be the community, if I go to the left, addressing issues affecting community health. And then the organization addresses issues which shape nursing practice. Bring that totally around to the government, which addresses laws, rules, and regulations governing nursing practice. So within all of those spheres, though they do touch on one another, is the framework for our particular, as nurses, action in this political arena of helping individuals through policy making and influencing it. So how do nurses influence policy? Well, first, through the laws, which are established rules and privileges. Next, through policies, which set the course of action. Public policy are government actions that affect all. Health policies is a subset of actions aimed specifically at healthy outcomes for the individual or group. politics, influencing others to accept a policy. Now, there are certain laws, and we're looking at that in Module 2. And that's a rule of conduct or action prescribed or formally recognized as binding or enforced by a controlling authority. They're enacted by any level of government. They can also be referred to as a program. For example, we had a law which set up the Medicare program. Now, health policies are public policies or authoritative decisions that pertain to health or influence the pursuit of that health. And health policies affect or influence groups or classes of individuals or organizations. Advocacy by nurses is something that we're really going to begin to look at in Module 4. Advocacy by expert and committed health professionals can really bring about the positive change that is needed both within the profession, the community, and also the patients that we serve. Building relationships, the methods for this, a letter or visit to a district, state, or national office of a legislator to discuss a particular policy or healthcare issue. Contributions of money, labor, expertise, or influence, and developing a grassroots network as well. Now, there's 6 skills for that political competence. The first, nursing expertise. That's a very valued currency, and we all have that. So we have clinical expertise, policy connections. We also have values. They're caring, health promotion, we're informed, and we view self-care and holism as a whole, if you will, instead of its separate parts. The individual is definitely a whole. Observation, okay, through decision-making skills, networking, crucial for actions and change. So you want to establish and maintain interdisciplinary relationships. Asking for help is definitely okay. Powerful persuasion, passion, thoughtful analysis of the ideas, clarity, ability to communicate is important to the audience. Now, number 4 would be our collective strength. The professional organizations, interdisciplinary, voices are louder, persuasion is greater, group consensus, it strengthens the individual. So having a collective response to something, to a policy, is much greater than having just one individual. Having a strategic perspective, so kind of stepping back, you place health in the broader context. See nursing as a political activity. Questions begin to emerge: government influence on populations, health, environments of care. You have to have perseverance. You have to remain optimistic because you don't always win. Now, the historical perspective on nursing and health policy, we have some early nurse activists, Florence Nightingale, for instance, in the 1850s. She looked at the environment when the British Army was fighting over in Turkey, and began to establish a policy of educational reform for nurses, but also began to establish a change in the environment in which we cared for patients, so that that environment was healthier. Clara Barton in 1881, she founded the United States Red Cross. Lillian Wald in 1893 founded the Public Health Nursing. And if we begin to look at our current time, or shall I say the close past, we can begin to look at Diane Carlson Evans, who in 1993 really put together a great policy and really got to the legislators, and finally the Vietnam Women's Memorial, in which there were a lot of female nurses, was built. And Karen Daly for the Needle Stick Prevention and Safety Act. And that was really big. She really was the spearheaded that whole policy. So I think that's kind of interesting in our history to realize that. And so here I have the various individuals, so you can take a look at that. Now, why nurses as policy advocates? Well, we're the largest single group of health professionals. There are 3.4 million of us at least. Registered nurses not only have the ability to be an incredible force just because of our sheer numbers, but policymakers also rely upon nurses' expertise. For more than a decade, nurses outrank all other professions in the Gallup's annual Honesty and Ethics Survey and are viewed as the most trusted profession. I do have 3 different hyperlinks here for you to go to, advocacy resource tools, and how to get to your advocacy for nurse legislators, as nurses to your legislators, your state legislations. These really, both of these links provide a lot of information for you. And we do have nurses who are legislators. And more women are becoming legislators, but also women. I think of Bethany Hall Long, who is the House of Representatives in Delaware. Now, what are some nurse political actions that happen to be the hot issues? And you'll notice up in the right-hand side, I have a logo from the American Nurses Association for their Political Action Committee, or PAC. Well, some of those hot issues are home health, for instance, Home Health Planning and Improvement Act. That allows nurse practitioners, clinical nurse specialists, clinical nurse midwives to order home care services. It ensures that seniors and disabled citizens have timely access to those home health services under Medicare, which had not always been. Safe patient handling. The American Nurses Association has worked to prevent injury and protect nurse well-being in the workplace through the safe patient handling and mobility programs and advocacy. Still an ongoing work, but we have been able to pass some laws into an act. Safe staffing. Again, the American Nurses Association and its constituent and state nurses associations in the states are promoting legislation to hold hospitals accountable for the development and implementation of reliable unit-by-unit nurse staffing plans. So how many nurses per how many patients per, of course, how sick are those patients. And then under Title VIII, Workforce Development Funds. So Title VIII is always coming up. It seems like an annual basis where they're trying to decrease funding. This helps to bolster nursing education from the entry-level preparation through to graduate study. So some of you actually are receiving funding from Title VIII. According to HRSA, between fiscal year 2006 and 2012, they provided loans, scholarship, and programmatic support to over 450,000 nursing students and nurses. Now, what are the strategies for political involvement that we can have? Well, you want to keep informed of the issues affecting nurses and public. So I know that many of you, when you have your legislation approved, what will happen is sometimes I say, but definitely in the orientation video, I say, please follow your policy along. Past the point where it was introduced, see it go in and out of committees, become informed, join professional organizations, find a mentor, and also be a mentor to someone else. Participate in public demonstrations, participate in shared governance councils, meet with elected officials in their offices, and write a letter to elected officials. You deluge them with enough letters, then again, the noisy wheel, okay, gets heard. Also, you want to publish on any of these particular topics that you feel really need political involvement. Now, as far as legislative action, nurses can be involved in the legislative process at any point. Some common methods of influencing health policy outcomes I already mentioned, but you can also send emails, fact sheets that organizations develop, or that you could develop and rally around other nurses in your area. News releases, speeches, coalition building, demonstrations, also lawsuits have come into play for this, petitions, various reports, so that's just one of many. Now, there is a conceptual basis for policy making, which I think is interesting and I really need to bring up. It's called Kingdom's Policy Streams Model. I will give you an example of this that will really drive this home. They say that first there's a policy stream going in through the policy window, which then comes out to an agenda, and that's what's in the figure here. And so first you have to identify the issue, and you want to define it. The next policy stream is formation and refinement of your ideas. The third politics stream here is the context, any changes within the government, pressure group campaigns, the public mood, any of those things. So you have the problem stream, the policy stream, and the politics stream. They go through the policy window, and this develops our particular agenda. I'd like to mention a very short case study in action, which followed those health streams. It was a model used by, at Drexel, our own 11th Street Health Center. It is actually a model for health centers within the nation. And Patty Garrity is in charge of this health center. And what happened was she critically assessed key public health functions. She demonstrated knowledge and skills in a range of topics related to public health, and then she formulated, implemented, and evaluated appropriate policy responses to public health problems. Let me do this. First, the key health problems that she found in the community. And this organization is on 11th Street, as I said, just a few blocks actually from where Hahnemann Hospital is. So the key health problems she found were diabetes, obesity, heart failure, and depression. The next thing that she did was she consulted with community advisory group. Then, to get more information, and then she determined that the health center needed to address nutrition as the main factor, because that was what the individuals were having a problem accessing. So if you don't have good nutrition, you then can't stave off obesity, diabetes, or even heart failure. So what she did was she worked to improve the health of those really living in the area. There wasn't a supermarket in the community until 2011. So what Dr. Garrity did as the director of the health center, she invited farmers to come to the neighborhood as part of a farmer's market. And she also created a community vegetable garden maintained by the local youth. She also holds nutrition classes that provide culturally relevant and healthy types of recipes and ways to use this particular food. So that was how those three streams worked. Now, there's also emerging communications phenomena that have transformed the political process. Okay, and we're going to be talking about this really in the first discussion board with social media. So some of the emerging communications phenomena have transformed that political process. New social media are already changing the way organizations track supporters. So soon television ads will be a thing of the past because today's methods of gaining support far outpace television, Twitter, text messages, Facebook, blogs, web pages, and I haven't even begun to touch on the half of it. So I'd like to ask that if you have any questions, please place them in the discussion board, and I welcome any questions that you have on this particular topic.